GP role in many ways hasn't changed over the last few years. So we still see patients with acute problems, minor ailments, the occasional patient who gets pregnant and so on. But what has changed is the amount of information that's available for clinicians, for patients and the public. We know a lot more about evidence-based medicine, and we're being expected to deliver more quality care within constrained budgets and think much more about the population of people rather than just the patient in front of us. Over the last 10 years there's been a very significant change in the type of technology that's available. Started with laptops, and then there were netbooks, and now there are smartphones where you can read your Word document, PDF or PowerPoint, and we're able to use this information at the point of care in the patient's home itself. I don't believe there is a difference between running healthcare and running a retail business, and the reason I say that is because we're both trying to look after the needs of our customer as best we can within the constraints of the finances that we have. However, there is a difference in that whereas in retail you're only offering a service to a certain group of people, in healthcare we have to deliver all care to everybody, whatever their means might be, and that brings challenges as well as opportunities too. The white paper challenges GP consortia to improve outcomes with the services that we have and also to constrain costs. But to achieve this we're going to have to build strong partnerships between local authorities, between acute trusts and also between patients themselves. I think the top three priorities for clinicians in terms of IT are enabling patient access and control to records. I think providing high quality information, evidence-based care pathways which lead to better outcomes and collecting patient-reported outcome measures, and finally being able to query the system so that we can find the individual bits of data that exist in the various different databases, both in primary, secondary care, community care and so on. Information is very important at the point of care so that we know what evidence-based pathway the patient is on, but also so that we can also see what data is already known about the patient, what outcomes we're trying to achieve, what the patient's preferences are, whether they've got advanced directives, whether they've got a care plan in place, so that we can make a joint decision between the patient, the clinician and the information that resides in the clinical systems to help achieve the best outcome. I think mobile point of care devices can make the most difference in long-term conditions as well as for patients who require care. That's because before we used to write things in paper notes that would be locked away and not accessible by other people. Now we have the ability through a mobile point of care device to record some data, some information, a history, examination, plan of action, and because it's electronically recorded it can then be made accessible by other people that are also delivering services to that same patient, or let the patient see that information when they want to. As the population ages, more and more people are in the latter years of their life going into nursing homes, so it's becoming a more important place to think about where care is delivered. Nick Barber did an excellent paper showing at 55 different nursing homes in 3 different areas, looking at 256 patients and looking at what medications they were given. Over 69.5% of them had had at least one error. I think mobile point of care technology could well help to improve and reduce those errors and make it much safer for patients.